Well, good afternoon, everybody. I can't see you, but I understand we have a lot of people here this afternoon for what I'm sure is going to be an extremely interesting presentation and discussion. And I'll be introducing Karina shortly, but we're delighted at ISSUP that she's agreed to talk to us today. I'm Vivian Evans. I'm the Chief Executive of ADFAM, which is the national organisation in England that supports children, families, friends affected by somebody else's substance misuse. And I'm also a board member of ISSUP. So I'm wearing two hats today. Parental substance misuse has always been a great passionate interest of mine. What we're going to do today, we're going to listen to Karina shortly. But please, if you want to submit a question, please do so. Please type them into the questions page of the webinar interface, and you can send in your questions at any time during the session. What we'll do is collect them and address them during the Q&A session at the end. We're recording the webinar, so that will be made available for you to watch on demand after the event. And also, we will email to you 24 hours after the webinar today a certificate of participation. So, as I say, I can't see you, but I'm delighted that so many people are here. I think it really demonstrates not just the interest, but the importance of this issue globally. And I'm delighted to be able to support ISSUP to take our thinking forward in this area and to raise challenges and opportunities for us to be able to provide better outcomes for these children. I'm delighted to introduce Karina Guacamelo. Karina is a consultant to the Pompidou Group for this project, Children Whose Parents Use Drugs, and she's also a professor at the Autonomous University of Chiapas in Mexico. I hope I pronounced that correctly. She has over 15 years of experience in advocacy-orientated research and development of legal, judicial and public policy at the national and international levels. Her lines of research include women deprived of their liberty, adolescents in conflict with the law, children with incarcerated parents, and women who used drugs. Karina, we're delighted that you're here today. Thank you so much for giving of your time, and we're looking forward to hearing what you have to say. And again, I could just remind you, everybody, about submitting questions live to our presenter and type them into the questions page. Karina, it's over to you. Thank you.
Thank you, Vivian, for the presentation. I hope that you are seeing my screen correctly. And thank you to ISSUP for the invitation. I'm very honored of being here and to be able to share this project of the Pompidou Group, for which I've been working as a consultant since the end of 2020. So my name is Karina Guacamelo. Good morning to all of you from Mexico. It's truly a pleasure to be here and to share this important project. So the project Children and Families Affected by Substance Dependence is a project of the Pompidou Group of the Council of Europe. I'm going to introduce briefly what is the Pompidou Group of the Council of Europe, and also what the project is about, of course, what activities we developed, with which countries we worked, what are the outcomes, and this is the publications that you can see in the first page of the presentation. I would really like to leave time for Q&A, so I will go through the presentation not quickly, but in a very concrete way. For this, I apologize if some generalizations will be made and if some issues will be perhaps introduced a bit more superficially, but the idea is that we can then go more into its depth through the Q&A. This is an international and super interesting project that has caused a lot of interest and motivation in different countries, with the idea of improving the way we address families affected by substance dependence. And for this, I'm truly honored and thankful that Vivian decided to chair this session, given her wide experience and the experience of her organization in this field. So let's get going with the presentation. So first of all, here we are. Sorry, I couldn't move it. Okay, so a bit of the background. The Pompidou Group of the Council of Europe consists of 41 countries Most of them are part of Europe, but there are also 3 non-European countries, Morocco, Israel, and Mexico. And basically the core task of the Pompidou Group is to mainstream human rights in drug policies. And it also has been playing a pioneering role in mainstreaming gender in drug policies. Then at the end of 2020, the Pompidou Group was invited by the Council of Europe, of which the Pompidou Group is part, to submit issues that could be of interest for the development of the new strategy of the Council of Europe on the rights of the child, which was approved in April 2022 and will run until 2027. So the leader of this project on children whose parents use drugs, Florence Mabilot, who's deputy to the Pompidou Group Secretariat and my boss in this project, she proposed the issue of children living in families affected by substance dependence, which is quite an invisible population, and it's not really been addressed either by drug policies that usually focus in children who use substances or children who can be involved by criminal organizations in international drug trafficking, but also the children's rights agenda hasn't really looked into the impacts of parental substance use on children from the perspective of also looking at parents. So it was quite a new topic, an invisible topic that concerns a very wide population. So that was the project that Florence Mabilot launched, and I had the enormous fortune of being selected as consultant for this project. And so what have we done in these years? Since the end of 2020 and the end of 2022, and then I will tell you what we are doing in 2023. We have had we've had 18 countries involved in this project, more than 300 people, 14 countries working, on an ongoing basis, always sharing their practices, actions, creating connections with NGOs, with service providers, etc. You can see the names of the countries on the screen. We have Croatia, Czech Republic, Cyprus, Greece, Iceland, Ireland, Italy, Malta, Mexico, North Macedonia, Poland, Romania, Switzerland, and Turkey. We developed the 2 reports, 4 ISBN publications, a dedicated page, which I will share now, where you can find all the other publications done in the project, and also several dissemination activities in different countries because of the interest that this project has developed. And that's the main key of the project. The reason why we have been able to do so much in a few years is because people around these different countries have shown a lot of enthusiasm and commitment and the desire to do more and more. And so this has also led to cooperation between countries and field visits between different countries and NGOs to share their practices. Let me share with you the page of the project, and then I will go back to the presentation. So I hope you're seeing it correctly. We've rehearsed this several times, so hopefully everything is going smoothly. So this is the page of the project. Here you can see Council of Europe, Pompidou Group, and a video of the presentation of the project and all the different publications, the first report that we did in 2021, and then the 4 books that you could see in the first page of my presentation, in the first slide. But let's now go into the issue of parents living in families affected by substance dependence. How do we approach it? And I think that this quote on the left side is quite, it crystallizes very well what's our approximation. So this is a quote from a mother in San Patrignano, a therapeutic community in Italy. And she said, "Children blame themselves and they wonder, why doesn't she love me? But it's not true. The mother loves her child, but the substance is too strong." So the project lies at the intersection of looking at children and the impacts of parental substance use. So as you can see on the right side of the screen, children may experience a wide range of situations because of parental substance dependence. They can feel neglected, they can have uncertainties about their parents' love, they may not go to school every day, not always have food on the table or clean clothes. They can feel isolation and stigma. They're afraid that something might happen to their parents while they're out, so they don't go to school, they don't go out with their friends. They may feel responsible for what's happening to their parents. So a whole range of situations in terms also of anxiety, of depression, anger, guilt, and so on. So on the one hand, we have children and what they experience, but on the other hand, we also have parents who are in the first place persons with their own life story that might also have been impacted by parental substance use when they were children, or by domestic violence or sexual violence. Parents who are also struggling with the double challenge of being a parent, which is quite a hard task for all of us, but that can be made more complicated if it also crosses with a substance dependence, which is the kind of substance use we focus on this project, not just any substance use, but only that substance use that, as defined by the people themselves, can complicate their daily tasks, their self-care, and the care of others. And then also parents may also face a hostile or stigmatizing environment. That's not always the case, and the people interviewed in this project refer situations of stigma as much as situations of support. But if we live in a context where substance use and people who use substances are stigmatized or even criminalized, of course, that hinders or puts higher barriers into having access to support, to services, and so on. So on the one hand, we have children, on the other hand, we have parents, and what we're trying to do with this project is what helps keep the dyad together, looking at each other in their own rights as individuals, but as part of a wider set of relationships that have to be taken into account. So that's in a nutshell, the core of the project. So since the publication of a seminal report in 2013 in the UK, the effects of parental substance use has been concentrated in the terms of hidden harm, which usually encapsulates two dimensions. On the one hand, it refers to the effects of parental substance use on children, what I was referring to before, situations of neglect, being witnesses of domestic violence, and so on and so forth. But on the other hand, also how children are undetected and unreferred to services. Why? Because usually when we look at social services, again, very generally speaking, there is some sort of ignorance or taboo around substance use. So maybe not always the social workers are capable of working on and with dependence. And on the other hand, from the side of treatment-related services, usually, again, generally speaking, the focus is on the person and from a clinical perspective, and the family is kind of left out or not so much taken into account. So on either side, children are not necessarily, that the complex issue of substance dependence and family is not necessarily seen as addressed as part of the family situation. But we also add in this project two further elements to the hidden harm conceptualization. One of it is the impacts of drug-related policies. Again, if we live in a context where certain drug-related actions are criminalized, that of course keeps people away from services. If we have an issue of stigmatization, that will also keep people away from services. And that of course will reinforce the fact that their children are undetected and unreferred. And then we have of course all what has to do with gender-based violence and discrimination and how this affects women who use substances in particular, and especially if they're mothers. So we consider that we have to look at these four elements and their interrelation and putting always the child at the center. So, and I will now go through very quickly the context of each publication, then I will share some of the promising practices, and then we can discuss further all the recommendations that have come out in this project. So the first publication that you can see on the right side, and that is completely available for free and for download, was published in 2022, and it collects 29 practices from 11 countries in different fields. Family and children-oriented services that take drug use into account, including national strategy. What does that mean? What I was saying before. So usually in the field of social services and so on, not necessarily dependence is always seen or taken into account or addressed as part of the children or family situation. So we look at those practices that do so. We have an example from Ireland, which is a hidden harm strategy. We have an amazing example from Iceland, from Italy as well, the PP program, prevention programs in Cyprus. But I will describe some of the practices later on in my presentation. Then we have programs and services for people who use substances that actually take into account children living in families affected by substance dependence, also in the field of advocacy and data gathering. Again, we have Ireland, we have Mexico, we have the UK, we have Czech Republic and Iceland. Then we look at those drug treatment services, mainly therapeutic communities, that allow women who use substances to live there with their children. And here we have examples from Italy, Ireland, Greece, Cyprus, Czech Republic, and Poland. And then we also look at those services for women who are survivors of domestic abuse and use substances, because that's a gap. Usually speaking, at the international level, women who use substances and are survivors of violence are not admitted in refuges. So what's the problem there? That if we know that if for a woman to actually go and knock on the door of a refuge, it takes a lot. It's a long process. But then if she's actively using substances and she's told that she has to get treatment first, that can send her back to the situation of violence that she managed to pull herself out from. So we look at two examples of refugees that work with women who use substances. And in this publication, one of them, Kwan Saur from Ireland, tells us how they made that transition from being a refugee that said no to women who use substances or gave them the suggestion of getting treated first, to actually welcoming women who use substances and working with both issues at the same time. So we collected these practices, but we don't do just that. We don't just describe them. Based on all the knowledge that the people shared with us very generously, we make very concrete recommendations that can be turned into public policies. So then, based on the very positive results of this research, which was carried out in 2021, published in 2022, the project continued. Countries kept saying yes, because in the context of the Pompidou Group, it's not that the Pompidou Group says, okay, we're going to do this and you're all going to send us inputs. No, the Pompidou Group shares the project and then countries decide to adhere to it or not. And in this case, there was a big addition of countries to the project. So we continued in 2022 and we developed the following next 3 publications. So one of the conclusions from the publication in 2022 was that we had to look at women who use substances in their particular needs, as a particular group with their particular stories, and with the need for increasing gender responsive services. So in 2022, we interviewed 110 women from 9 countries who shared their insights on their own story. About 66% of them experienced parental substance use in the family, so they kept repeating this transgenerational cycle of substance use. They experienced neglect. More than half of them experienced some sort of violence. 89% were mothers, 4 of them were pregnant. And so basically they share what their insights about their personal story, their substance use, their relationship with partners, and also the facilitators and the barriers that they found in services in the field of treatment, of social services and hospitals, in order to actually what helped and what didn't help. And they make amazing recommendations to other women, to services, and to children. And then these are some of the testimonies. I will read them very quickly. You can find them all in the publication. So Lisa from Mexico says, the women I have met in rehabilitation centers, they all come from the same reasons. They all come for abuse, for mistreatment, because their father is on drugs. They come for different stories of connection, but I think we all go through rape. The issue of sexual violence, sexual rape in Mexico was particularly high, but it was more or less present in all the different countries. And then we have the issue of stigma and self-inflicted stigma. So Julia from Italy said, I was very happy to be pregnant, but I didn't want to tell. I was ashamed of being pregnant because I wasn't a person who could be happy about being pregnant. I didn't have a stable life. I didn't have a house. I didn't have a job. I didn't have anything. So I couldn't be happy about being pregnant. And Noemi from Mexico added, they tell me I'm a drug addict, but they don't ask me, why do you do it? What do you feel? Or better still, have you eaten, kid? So these are just some of the examples of the many testimonies collected in this study. This is from Shiv, Ireland, and I would just like to read the second part because I really want to make sure that I go through all the contents, and I think it's very important for services. She said, the first thing I think should be asked to a woman or a mother who was attending the service is, what do you feel you need to help you manage? Having realistic expectations of the people who are attending to service, asking, is this manageable for you? Leaving the door open and the possibility to say yes or no. And if they say no, be able to accommodate. Because basically what she referred is that when all your life revolves around substance use and you're obsessed with the substance, then it's very difficult to keep up to an appointment, to be there on time, and so on and so forth. So in order not to be rejected and to keep going to a service, there's need to be this recognition that the person is powerless over the substance and that there is a complete, as she refers it, unmanageability over the substance. So then we have listened to the silence of the child, an amazing study to which participated 33 children and young adults from 5 different countries, most of them from Mexico. This initial quote is from Alex, and Alex's apologies are a false name, of course. course, 14 years old, from Greece. And when we launched the ice-breaking question, so what do you like? What's your name? What do you like? Can you tell me about you? His answer was, my name is Alexis. I'm 14 years old. I would like to have a family with no drug issues, people who take care of me, and I would like not live illegally. And then when he was asked the question, so what would you recommend to services? He said, teachers and services must be patient with children. They must hear the voice of the child and the silence of the child. It helps to be supported in everything without the danger to lose your house and be in an institution. It helps if the child can have a quiet home, therapies for the parents, a school that understands, and a network that supports in food, clean clothes, clean house, quiet sleep, studying, going at school on time. Therapies are helpful, but children do not like going to therapy. So the title, Listen to the Silence of the Child, is taken from Alex's participation, which just in a few sentences basically outlines the roadmap of what children need from different services, from schools, from parents, from social services, from drug treatment services, and so on. And there is this urge of children wanting to be listened to that came out all the time. And that's one also of the key legal approaches of the project. Participation is a right for children, not an obligation, and is a right that brings more protection, because usually what we found, and it was very difficult to get interviews with children, was that protection it stands up as a barrier to participation, but children are eager to participate, of course, following the ethical standards that need to be followed and that are also established to make sure that their participation has a space, has a voice, has an audience, and also has impact and a feedback on how their voice is actually used to inform accountable policies. So this is also an extract from Pachis, a young adult from Mexico who experienced both her parents' substance use. And she said, when he was using, my dad would change and that man of love or respect would leave and go into survival mode. I didn't know when it was going to happen again, when I was going to witness a fight. I didn't know when I was going to have to move, when I was going to have my school safe or not, when I was going to have to eat or not. I didn't want to go to school because I was worried about being at school, because I didn't know what was going on at home. I didn't know if my mom was okay, if my dad was going to do something to my mom. We got to the point where we had to hide everything of value so that they wouldn't take it away, people that his dad owed money to because of the substances. And in the end, my house was destroyed, empty, and that's where my dad committed suicide. These are life experiences that I really don't wish on anyone. However, I know that I'm not the only one. There are so many girls and women who say that a close relative could not overcome the struggle. And there are so many of us, and we don't talk about it. So then we did this other research, which is very similar to the first. Here we collect again the voices of service providers, of practitioners describing 33 programs from 11 countries that again look into actions in the field of data gathering, parenting programs, multidisciplinary holistic approaches to working with the families, services for women victims and survivors of gender-based violence, protocols of cooperation between services, drug treatment services, and residential communities for women and children. So very similar in a way. Some of the action repeat itself, but we also had, of course, many new actors that brought in their experience. So this year, what we are doing is two things. We are drafting guidelines for the development and consolidation of comprehensive services for children and families affected by substance dependence. So all this wide knowledge developed in the last 3 years, we're all putting it together in this instrument. And then we're also starting to look at the issue of fatherhood and substance dependence from the perspective of masculinity, parenthood, and the right of parenting. But this is just a very initial study that then will be developed in more in-depth research in 2024, following more or less the path that we followed with women who use substances. So this is overall the project and what we've been doing, the outcomes, and some of the issues we looked into, and all the generous voices that participated in it. What are some of the promising practices? And again, this is just a small overview, because there are many more that can be found in the publication. So at the policy level, of course, we acknowledge the hidden harm strategy and training in Ireland. It's the only country of those participating, of course, that has a strategy focused on this population. We have the PP program in Italy, which is a national policy that works with families in contexts of vulnerability, making sure that there is a horizontal way of working between social workers and the families. It also encourages children participation through a tool that is UK-based, which is called the Triangle, the World of the Child. And that also implies it also implies multidisciplinary teams. So basically we have people from treatment services, people from social services, and so on, working together around each particular case. In the field of data gathering, again, Ireland stands out with a national drug treatment reporting system, which includes a specific question on the number of children of people who access treatment and their situation of care. This is super important to know how many children we are talking about and where they are. And then the RPM Online, which is part of PP, and it's an online way of sharing information on each particular case from the members of the multidisciplinary team. In terms of social services that take into account families and dependents, we have the prevention programs in Cyprus that are targeted at children from vulnerable families, but that also, in case of detecting a case of dependence, makes the appropriate referral, as some of the organizations that implement the prevention programs at the local level have both services, the treatment service for parents and the wide range of activities for children, such as guitar classes, English classes, robotic, taking them on holidays, counseling, a whole range of activities for children coming from vulnerable families and that wouldn't have access to all those possibilities in their own family. Preparing for Life in Ireland, which is an organization working with families in contexts of vulnerability. The identification and referral mechanism of children with incarcerated parents, that's super important to bring in also this population, especially in the case of children with parents who are in prison for drug offenses or parents who are substance users. And then again, the PP program in Italy. In the field of drug treatment services that take into account children and families, we have the Rialto Community Drug Team in Ireland that works with people with substance dependence, adult population, but that also has the Family Works program that works with the whole family, and that also created a joint program with the outreach program for young people. So basically combining the expertise of treatment with adult population with the outreach program for young people and bringing them together. We have Bali Format Star also in Ireland that works with people who use substances, but also has a space for their children in the facility. And also, that's super interesting, has an outreach program for a refuge. So where women who use substances and are survivors of violence go to Bali Format Star, they can also talk to the person from the refuge, and then that can be a referral to the refuge itself, which is mentioned here, Seorsea in Ireland. So that's a very interesting program because it works with the three issues: substance dependence, children, and issues of domestic violence. We have the daycare center in Sananim, Czech Republic, Addiction Switzerland, which is more an advocacy awareness raising organization. Parents Under Pressure, a program for parents implemented in Colomite, Ireland, and then the program of the Society of Alcoholism and Other Addiction, SA, in Iceland, that has a specific program for children of people with alcohol and other substances dependence. So that's completely targeted at children, and that's the only program we found that actually is developed for these children, and it's in the public, official, biggest treatment center in Iceland. Now, in the case of treatment centers for women and children, as I said before, we are mainly looking at therapeutic communities. So we carried out interviews with San Patrignano, Casa Mimosa, e La Rupa Femminile in Italy. We spoke to service providers, but also to the women. Ashley House, Coolmine in Ireland, which is the only residential community for women in Ireland, and then also opened another facility last year, the therapeutic community Karlov from Sananim in Czech Republic, the specialized unit for addicted mothers in Greece, which is part of the psychiatric hospital of Athens, and Agia Skepi in Cyprus, a therapeutic community that has a male section and a female section, and where women can live with their children. And then in terms of refugees for women who are survivors of domestic violence and use of substances, we found Spavo in Cyprus and 2 experiences in Ireland, Coansau in Soursea. And so these are some of the promising practices. As I said, there are many more. And now to conclude my presentation, I would just like to share these last voices from children. The first is from Milo, 8 years old, Malta. At the question, what do you think services could do for parents? He replied, we have the mom and the dad, help them get used to cooking, driving, everything. We teach them how to write and read. And then Marisol, 17 years old, Mexico. I wish they had explained it to us at school about the problems with drugs and alcohol, because I know people my age who already have ugly problems with drugs. I think there's a lack of information. It's not just like taking drugs or drinking is bad and then don't do it. I think that with the background that I have, I would like them to explain things to us, like drinking can cause this, not only to you, but to your family, and things like that. Not only to us, but also to the parents. I feel it feels bad as a child because you don't know what to do and you don't have the tools. So support to parents, information and support to children. And then all of these kids had very powerful messages for their peers. And the main message was speak up. So Maria, 15 years old from Greece, she says, I would tell them not to be affected or bothered by what their parents do and not be like them, such a mess and bad example for their kids. And yes, it would be good to have someone to talk and not feel embarrassed. There's no need. So this is the presentation. Thank you very much for the possibility of sharing it. Now I will go back to the screen. Sorry, I'm trying to stop sharing it, but I am a bit confused. I don't know if Olivia could help me there. Oh, thank you. Fantastic. So yes, thank you. Thank you for your kind attention. And I was very glad that I could share this project with you.
Thank you very, very much indeed, Karina. That was brilliant. I'm going to move on to some questions for you now.
Yes.
I don't know. Well, I'm just the first one is from one of our colleagues from Pakistan, who says, as I'm from Pakistan, are there any connections to work with a Pakistani population that you know of?
No, my answer, I'm afraid, is no. We don't have any connections with Pakistan or related countries. There was at one point an invitation to present the project in Kerala, India, but that's the closest we could get. And it wasn't us actually presenting the project. It was Monica Barzanti from San Patrignano, a big ally in this project. But I don't know if there was any further work. However, I think it's something we can research on an inquiry about. Perhaps
the inquirer could get in touch with you, Karina. Would that be all right?
No, of course. Actually, I wanted to say if someone wants to get in touch, yes. I would kindly ask ISSUP to give my email and we will continue the conversation. Yes.
Okay, I'll move on to the next question. This is quite similar, but this is from one of our colleagues in Paraguay. Is there any possibility that we can establish links to have your support to work together in Paraguay?
I think here the best who could provide, I can provide an initial response and I guess just to be in touch with me, but then who could provide the best response would be the Pompidou Group itself and Florence Mabilot, the leader in this project. The Pompidou Group has connections to Latin America through the Inter-American Commission on Drugs and Drug Abuse. We had some work with the Junta Nacional de Drogas from Uruguay. So basically, I provided some training and basically what I just did here, we did it with Uruguay as well to share the project. That's definitely possible to have this, at least this contact with the Pompidou Group, and to have the project presented to members of your country, and then we can see how it goes from there. So again, there are two channels: the institutional one through the Pompidou Group, which I can help facilitate, and then the spreading the information of the project like we did it now. So that's definitely possible. Now, as to be part of the project and so on and so forth, I think that's a thing to be seen with the Pompidou Group directly, not with me as a consultant. But again, I can facilitate the bridge with the Pompidou Group.
Thank you, Karina. Our next question is more general. Our colleague says, within the households that you described, there's sexual abuse, violation, murder, people trafficking, organised crime, violent deaths at an early age. There is no specialised treatment offered for women of various ages, adolescents or adults, nor governmental institutional capacity to address these cases, not only in Mexico, but throughout America. What do you think?
Can I ask where the person is writing from? If she or he specified?
I don't know.
No? Okay, well, but mainly because she or he refers from America. What I can say from the situation I know in Mexico, which is where I've done more research in the last 15 years, is that indeed one of the consequences of the implementation of US-led drug policies in Latin America is that the supply control actions, particularly the use of incarceration, has been the main response. And there is definitely that people who use substances are definitely underserved. There is a lack of quality public treatment services of different ranges, from harm reduction, outreach, to therapeutic communities, proper ones, and treatment in prison. So what we have, again, in Mexico, at least, in the Caribbean, in Central America, in Brazil, I'm not sure about Chile, Argentina, Uruguay, but we have a huge presence of religious, self-named, because they're not religion in how they practice, private treatment centers where basically compulsory drug treatment is the key. So people are kept there against their will. Families have to pay a small amount, but which is a lot because we're talking mainly about very poor families. So yes, definitely what we have in the context of Latin America is that people with substance dependence are underserved, and that the main thing that comes to their mind, and that came up in the interviews with women in Mexico, is that the first thing they think of is not the available public services, because they are there. It's just there are more private centers and there's more compulsory drug treatment than quality public treatment. But the first thing that everybody thinks of is these annexos, these semi-legal places of arbitrary detention. So definitely there's a need for it, and often also very young girls who start using drugs because of all the experiences of sexual rape and domestic abuse. They can easily be co-opted by organized crime and be turned into hit women and so on. I did quite a few of interviews in that respect in Mexico, and actually I would like just to say, finish with a sentence. Usually when asked about what were the main implications of substance use for women, women from different countries said the fear of losing our children, the fear of having to be involved in sex work. And so basically what's that? Sex work and the fear of losing our children. Only in Greece, one, and most of the women interviewed in Mexico would also reply, the risk of being killed or disappeared. So they saw femicide as a very likely outcome for being a substance using girl.
Thank you. The next question, can you share with us, please, a little bit more on how to execute the right to participate of children in the treatment process of the parents, the parent is using drugs? How to execute the right to participate, the child's right to participate?
Yes, I would like, first of all, to make a clarification that since I am not a practitioner myself. I do not have the tools to explain, you know, how to do it step by step. But what I can say is to refer what some of the allies in the project referred to us. So that's what I'm going to do, mainly referring to the program PIPI from Italy that uses this UK method of the word of the child. I wish I could. Well, I will try then to find the triangle. If not, I will describe it. Basically, the tool that they use there with the child is called the word of the child, which is a triangle. At the center, one puts the picture of the child, or the child can put his name, his or her name, his or her picture, his or her drawing, you know, whatever the child feels more comfortable with. That's also a way of, you know, creating a bond and fostering participation. And then each side of the triangle identifies the three main elements of the word of the child. The one is, what do I need to feel good? So maybe I need to go to school, I need to go to bed on time, I want to see more of my friends, I want people who take care of me, I want people who tell me a bedtime story. You know, anything that the child needs is developed on different issues that have to do with the emotional, physical well-being of the child. Then there is the other triangle, which says what I need from other people to do so that I can feel good. And that then leads to understand what are the things that the child is not seeing or seeing at home. So for example, it could be, again, I need, I don't know, my mom to feel good, or I need my mom to take me to the park, or I need my dad to spend more time with me. Any need that the child identifies on the same lines that has to do with the multiple dimensions of the well-being of the person. And then the other one, the base, is what do I need my community to do to make me feel well. So it's basically based on the ecosystem approximate approach. So it looks at the different dimensions of the well-being of a person: myself, my immediate surrounding, and my community. And that is used as a tool to identify the children's needs and aspirations. It's also used with the family. And then based on that, the family and the social workers develop a plan of action that can entail very small things, such as have a bath every evening at 7, or read a bedtime story every night. And so specific steps are identified. That's a way to develop a plan with a family based on children's participation. Then there is, of course, the Lundy model of participation that includes having the space, having the voice, having the audience, and having the impact on policies. And in the case of Iceland, we have this program that is specifically for children living in families with parents who have alcohol or other substance issues. And that is also a way of having children participating through a very active, with several dynamics, not just counseling, in individual and also group sessions. So these are just some examples of the allies we're working with. So yeah, this is what we could find also in the more developed in the project.
Thank you, Corinna. I'm just thinking it would be really helpful if you could remind people where to get your publications from. Would that be okay?
Yes,
maybe Olivia Isa could do that. Thank you.
Yeah, I don't know if I could share again the screen and show again, or if Olivia could help us share the page and the screen. And I would also like to say, sorry, that I just received a communication from NACOA, who's following the seminar, and to actually say that we mentioned NACOA in the first publication, in the one from 2022. We put the example of NACOA UK. Unfortunately, we could not work with the UK directly. Otherwise, I'm sure that also Vivian's work would be reflected very much in the publication. That's not up to us. As I said, it depends on the countries that are part of the Council of Europe and adhere to the Pompidou Group project and so on and so forth. But yeah, so this is the page. It's COA, Council of Europe .int. And then but basically, if you on your browser you put Pompidou Group Children, this is the page that should come up. And here you have the description of the project. Every report, even those that haven't been published and presented today, do give quite I don't know, they give a lot of information. Like the first one, this one, preliminary assessment and proposals, brings in all the legal framework, the legal tools, and a comparative of several countries. So it's quite interesting per se. And this one, sorry, Report of focus group held in February 2021. 10 countries participated in the focus groups, and they bring in a lot of knowledge and reflections as well. And then the other ones, the ISBN publications, this one, and then these 3. Well, they're the ones that I described today, and that have all the different practices and voices included. So yeah, basically this is the page of the project where you can find everything.
Thank you, Karina. Here's a more specific question now. Are there any have you come across any peer mentoring elements in the projects that you've looked at?
Let me think. No, I must say I have not. For another project also related to the Pompidou Group, I looked into peer mentoring programs, and I think the European Monitoring Center for Drugs and Drug Addiction shared some good practices in that field. But in our project itself, no, there was no peer mentoring program.
Okay.
Which I think will be super necessary as well. But...
Okay, thank you. Another question. Do you believe that harm reduction strategies will become more common standard practice instead of abstinence in drug policy? And have you seen a change in opinions and stigma towards families with substance misuse problems overall?
I would say that in this project, but again, we have to start from the fact that there is a, I don't know how to call it, a natural positive bias, that people and organizations that were attracted to this project were mainly people, organizations, and countries that want to be part of that change of mindset and policies. So of course we had more positive examples and we didn't have any negative one. But so yeah, I would say that at least in the context of Western Europe, there is definitely an ongoing reduction in terms of stigma, a widening of actions in terms of harm reduction. I'm not sure, and I also think that I don't know if I would put it as more harm reduction, less abstinence. I personally think, but that's a personal opinion, it's not, let's say, put that in the project, that of course, if we can think of people having different levels of coexistence with substance, that's more accurate and more tailor-made and more reasonable as well. We had a conversation about this in Czech Republic with Sananim. In Czech Republic, they have a degree in addictology. Super interesting. So the people working in the organization, Sananim is one of the biggest organizations working on drugs in the Czech Republic. It's one of our big allies in the project, and it has everything from the outreach point, where people just come in and take their needles or their substance substitute, or they can just chill out. So they've got the super outreach point, but also the therapeutic community. And I think that's the key, to have a wide range of services depending on the needs and the wishes of every person. So not just push for one model, but to have a wide offer. In Sananim, they also have services for formerly incarcerated people. They have the, what was it called? So I'm not going to say the correct name, sorry, because I don't remember it, but I will convey the concept. The post-rehabilitation, so when you come out of the therapeutic community, you can go and stay in another place of the organization while you get your life back going, and you find a job and you find a place to stay. So they've got everything. And for me, that's the model. I would also say in countries such as Iceland, for example, definitely they've done an amazing work in reducing substance use and stigma. People who are on treatment, they keep their paid job. So, you don't have the risk of, okay, because for example, in Italy, you can keep your job, but you don't receive your stipend. So that can be a barrier to access treatment. What are you going to do if you don't get paid? So I think there's been definitely more development in that sense. In the last pronunciation of the United Nations Human Rights Council, there was, again, a clear statement on harm reductions. I think that's been pushed as well. And I think it's almost a fact in Western Europe. But I think, it will take more and more ground, although I also think that we need a wider range of services depending on, each person's situation and wishes as well, not only needs.
Yeah, so certainly in the UK, I mean, there's in fact, yesterday, some people may have seen this because of the number of drug-related deaths in Scotland. There's a move towards decriminalising substance misuse in Scotland. I don't think that, personally, I don't. There's going to be a long time before that happens here, but it's certainly, I agree with you. And there's been a lot of work here, and I think, you know, across globally around trying to combat stigma around substance misuse. So yes, thank you. Thanks, Karina. I've got some more questions. Can you, we just find that this one here. Can you tell us a little bit more about the long-term effects of parental substance misuse on children's physical and mental health? How it affects the development of the child? Just give us a little more of a flavour of that, if you could.
Yes, that will be, again, based on the literature we consulted for the project. Basically, the starting point is adverse childhood experience model, which identifies 9, well, now 11 adverse childhood experiences, and one of them is substance abuse in the family, which usually, however, interconnects with other situations. So it's the same, sorry to open a tangent there, but it's another area of my work, children with incarcerated parents. We can identify that parental incarceration is an adverse childhood experience, but it's very difficult when we study the situations of people who grew up with those childhood adverse experiences, how to disentangle, you know, what's the weight of parental incarceration or unemployment or domestic violence and so on. So in a way, parental substance and alcohol misuse is part of those experiences. The calculation is that a score of 4 or more adverse childhood experiences predicts more negative outcomes, which is a formula that I personally don't like. I mean, I understand it's important in scientific terms, but it's always a bit that perception of looking at people as children as assets for the future and not, you know, in their own situation, but still it's necessary to predict those outcomes and to intervene on it. So it can lead to several outcomes in terms of substance use, and we see it in the stories of the women we interviewed and also fathers, you know, but usually they tend to report that they lived substance misuse in the family and they're repeating it and they want to break the cycle, but the cycle repeats itself. In terms of mental health, in terms of post-traumatic stress disorders, in terms of achievements in school, for example, as well, and in relationships. And in a way, again, it happens also with children of incarcerated parents, where we can see that if we look at people who are incarcerated, there is a tendency to have lived incarceration in the family. So it can predict outcomes in a sense also of repeating the cycle. However, there are also people who do not experience any negative outcome. So it's also important to keep that in mind. You know, for some children, they will experience it, for others they will not. So I think it's also important to identify all the factors that interplay. We cannot just, of course, we need, when we do a project, we need to put up, you know, we need to define a scope. We can't investigate everything. So here we are reflecting on parental substance use, but never to forget that that usually doesn't come alone, and that we have to look at all the different issues that form a part of that experience that often also have to do with the surrounding situations. The stigma, for example, is in itself, in the case of children with incarcerated parents and children with substance misusing parents, is in itself a long-lasting situation, a long-lasting source of negative outcomes.
Absolutely. Yeah.
That's been completely studied in the case of children with incarcerated parents. So if you experience stigma, you're much more likely to sort of fulfill that, you know, that, what's the word in English? That prophecy of, okay, if you're the son of a criminal, you will be one yourself. If you're the son of a substance using person, you will be one yourself. Stigma is a predictor for not breaking the cycle, and I think it's a very important one to work on.
Indeed, absolutely.
Sorry, I interrupted you. Sorry.
Karina, we have a lot of questions from people in individual countries who are asking questions about their countries. Is it, do we have your permission to put your email in the in the chat here on the webinar, so people can get in touch with you directly if they
Yes.
have a specific question about their country.
Yes, of course.
Is that okay? Okay, thank you very much. So that's what I suggest, because then we have quite a lot about specific countries. But I have a more general one here for you. Will you, in your project, will you go on to look at racial differences around parental substance misuse, and differences in experience from, for example, LGBTQIA families and children, parents and children? Is that in your plans? And if not, is that something you think might be interesting to explore?
I think it will be crucial to explore it, and thank you for the question. And especially when we're also thinking about migrant populations, in the case of Europe, in the case of Mexico, we can think about indigenous population, for example. North America, of course, there's a lot of racial discrimination as well. So of course, I think they're both very important issues. In the case of women, I would like to clarify that when we talk about women who use substances, the way we use the term women is, people who identify themselves with it, basically. So it's always been open to, to people who would see themselves as women, but we basically had in the project, not because we decided so, but because of the people who were part of the interviews, heterosexual women. So it's completely open. I must say that even if we mention it in the project, we don't have that intersectional approach yet. I guess because there's been quite a lot done, but also a lot that has to be done yet, of course, to bring in that intersectional perspective. In the immediate future, we are going to look at fathers who use substances and the guidelines. The project is part of the Pompidou Group work for the period 2023-2025, and we didn't include, at least for this year, that intersectional perspective. I think I will bring in the question. Of course, I'm just a humble consultant. I don't know what will happen next. It's not my project. It's the Pompidou Group project. I don't know how long I will be there for, but what I can make sure of is that I will bring in the question, and if the project continues to develop, to include that intersectional perspective.
Thank you. There's a question here from the UK about the hidden harm document, which was produced in 2003, the inquiry into children of substance using parents, children of drug using parents, and why isn't the UK taking more of a role in this work? I would agree that we've taken a few steps backwards in the UK. I was involved very much with the hidden harm report 20 years ago, and I'm not sure that we've progressed as far as certainly the ambition was of those of us on the committee that produced hidden harm. But that's my personal opinion. Another question for you, Olivia, unless you have any comment on that about the UK's position. Do the children of drug or alcohol dependent parents experience post-acute withdrawal symptoms during their early childhood? That's a very specific question.
Yes. So with regards to the UK, sorry, I have to share my ignorance here, because I'm not sure what's the UK status within the Council of Europe after Brexit. I mean, I'm sure I could look it up, and I didn't think about it, but I don't know. But basically, as I said, for this project, the Pompidou Group says we are going to do this project, and countries adhere to it or not. And we work with the countries that are in the project. So we included NACOA in the first publication because a partner from Ireland suggested it, but I couldn't reach out and work directly with the UK, to put it that way, because it's not part of the project. Which would have been great, because I'm sure, as you said, it basically launched the topic out there, but that's basically the reason. Then with regards to the second question, again, it goes beyond my field of knowledge. There are different studies on the impacts of maternal substance use on the fetus and the newborn, and it can have impacts, but also science is always, you know, under review and questioned, and new evidence comes up. So there will be a tendency to say that yes, the use of certain substances during pregnancy, if not interrupted or substituted with other substances, can lead to withdrawal symptoms. They're usually the recommendation of not suspending opioids use, but to look for a substitute to avoid withdrawal. But again, that's again a scientific knowledge that goes beyond my field, although there is literature on it. What I can say is that in the case of several women that we interviewed and that didn't stop using cocaine during pregnancy, their kids were born with withdrawal symptoms, which can be indeed very painful for the child, and they were taken away from them. They were put into a foster family, and the women were sent to treatment until, you know, they could show that they wouldn't be a challenge for the children in a way, and then would be reunited. So that's all another issue that we address in the project.
Karina, thank you so much. We've run out of time, I'm afraid, but I think what we've all demonstrated is that there is an acute interest in this topic, great deal of interest, and I think something maybe that at ISSUP we can continue to explore. Thank you so much to all of you for attending, and thank you for all your questions. I'm afraid we weren't able to get through all of them, but I just reiterate that if you do have any specific questions of your country, please get in touch with Karina directly. Thank you again, Karina, and let's all look at working together globally to tackle this problem of parental substance misuse. And thank you to Olivia for organising this and doing all the wonderful technical work. And everybody, whatever time it is, wherever you are, enjoy the rest of your day. Thank you.
Thank you.
Thank you. I don't know.